All right, so the first main factor that's going to affect your overall mobility comes down to what are you doing regularly for exercise. This is where you get what you train comes into play. Your body and your brain are in a constant state of adaptation, trying to make the regular demands that you put on it easier. This is where specialization comes with sacrifices. If you tend to specialize and prefer a certain kind of activity that requires a certain kind of shape, then over time it will be easier and easier to take that shape, whether it's very closed, say in cycling or getting into more of a rowing position, or whether it's more open, say in overhead activities, Olympic lifting per se. You get what you train, and if you make that face just enough, it's going to stick. So variety is helpful. All right, so if variety is helpful, the question comes down to what sort of variety is going to be helpful? Well, if you look at the body in terms of shapes and the different positions and the different movements that it can take on, if there is a preference toward a certain motion, if there is a preference towards a certain shape, then working towards being able to do a little bit more of the opposite is going to be helpful. A very simplified example would be if someone takes on a lot of road cycling, they're going to benefit to make sure to get their arms overhead and do a lot of activities with their arms overhead in a more open position. And vice versa for the person that does a lot of overhead stuff, they're going to have a hard time closing down and they're going to benefit from a little bit more of compressive activity. All right, so taking on the opposite shape of what you tend to do regularly is one way to possibly improve your overall general mobility, and doing exercises that require you to go into those different positions is probably going to be helpful in slowly over time improving your general mobility. But another thing that's enormous for all of us to take on is some opposite arm and leg activity. It is much easier for the compressed individual to open their body up by shifting an opposite arm forward and back. That will open one side and close the other. Vice versa, if the very open individual works to try and close, that's oftentimes too hard. They need to close one side and use the other one to help get them there. So opposite arm and leg activity is a big deal.